In this video I am going to explain to you how to use and how to correctly assemble a penis extender. It is something that many patients ask me, and also many of you, of the people you see. I have a friend who watches the videos about the penis extender, ask in the comment boxes, and that is why we have made a video with a penis extender, in which I am going to explain to you what comes inside the box, how it is assembled, and how you have to use it correctly. So this is what comes in the penis extender box. What we have is the base of the extender. This is the tip. Here are some metal cylinders to adjust the length of the extender, and here is an alternative that we can use to grab the glands. So we have the extender. The penis is going to be located here, and we have to put this notch facing the feet, okay? We are going to place this at the tip, and we are going to make this scarf with the vertical openings. As you can see, it can be adapted depending on the anatomy of each person, since bigger penises, smaller penises. If this is the size you need, perfect. If not, what we have to do is 4 centimeters. We can even really get a very important length. So when we get the length we need, we are going to leave it like this. If this is the length we need, we are going to enter this here. How are we going to put the extender? So the first thing is to release. I put the penis here until the glands appears here. So I take the glands with one hand, and with the other hand what I do is pull, and the glands has to be trapped outside of here, okay? You don't have to be able to get out. Some men explain that this scarf with this white band is not enough, so we have another alternative. What we have to do is remove this white band. We can also use this. We can put this covering our penis so that it has a little less friction, and we open this silicone rubber. I'm going to remove it from here because it's easier to see, and what we have to do is put this silicone rubber through these holes. This requires a little practice and is more or less difficult. As soon as you have passed it, what you have to do is take from here, and from the other you have to pull, and then it passes easily, but you have to manage to maintain the tension. We also put it through the other hole and do the same. We put it back on the tip of the rods and do the same. Here at the beginning, make sure it is very loose so that the penis fits without any problem. We place the penis so that the glands is widely above it, and what we do is capture it with this silicone rubber, okay? What is the reasonable size you should start with? You have to notice tension but not pain. That is to say, if you put on the extender and you really don't notice anything, you don't notice that the extender is pulling, you may have to add more size. If, on the other hand, you put on the extender and the extender pulls too much, it hurts. The pain is not reasonable with penis attraction therapy, and therefore what I would do is possibly remove in centimeter. When placing it, I have to pull it down, place the penis, adjust the pressure on the glands, and release. So this is when the extender will come into charge and produce the attraction, and that is what I was telling you about. If it does not produce enough attraction, then we have to add a little more length. If you really notice that you are very uncomfortable, that it hurts, then surely we have to take a little more size off. As advice, I tell my patients to start using it over time. As the weeks go by, you should notice that the measurement that bothered you a little bit and you noticed tension a couple or 3 weeks ago is starting to be more comfortable. You're starting to notice it less, and that means you need to lengthen it a little. But you have to add a little more length to the extender to continue generating tension and generate lengthening or straightening of the penis. To add length, as I mentioned before, what we will have to do here is an extension of 1 centimeter and an extension of 2. Because what we will do is remove these 3 centimeters and add the 4 centimeters so. As you can see, this one is longer. Here we will do the same. We remove these 3 centimeters and put the extension of 4, and so what we are doing is that the extender is 1 centimeter longer and will generate more tension on the penis. We put it on, we release it, and then the penis has to give tension. It has to be uncomfortable. It can be annoying, but it shouldn't cause pain. So when you put the extender to the length that corresponds to you, you can make the fine adjustment with these 2 wheels here on the base. What you will achieve is, as you can see, here you will achieve a finer adjustment too. Make sure not all increments or decrements are 1 centimeter, because you can make the finer adjustment using these wheels here at the base of the extender. How often do you have to use the extender? It is a topic of debate. Possibly in peyronie disease there are some studies that say you have to use it for more than 3 to 6 hours a day to get straight. Regarding penis enlargement, it is possibly a little less than around 2 hours a day, and it is important that it is a common consultation that can be fragmented. You can use it for an hour, stop for 5 minutes, and then use it for another hour, etc., etc. What can we get in peyronie disease to loosen the curve? We know that there are studies that show that in 12 weeks on average we are going to lose approximately 15 degrees of the curve, which means that there are people who lose less than 15 degrees and people who lose more than 15 degrees. Unfortunately, it is not a guarantee, but it is a treatment that works very well, and in penis enlargement in studies also at 12 weeks what has been seen is that we can expect a gain of between 1 and 2 centimeters of penis length, and that gain will be consolidated. That is, if you stop using the extender you will not lose that length, and a common question is also if lengthening the penis makes it slimmer, and the answer is no. We preserve the thickness and what we get is more length. The penis extender can be used by both circumcised and uncircumcised men. If you are circumcised, the skin will be drier, harder, and possibly it will bother you less. In men who are not circumcised, you can use this foam on which to rest both this white scarf and the silicone strip so that it does not bother you as much. Something I usually recommend is using the extender with the foreskin covering the glands. If you lower the foreskin and put traction on it, it may bother you, but it is something you can try. The extender, as you can imagine, is a procedure that is very effective, but it is not comfortable, and that is how it is. In other words, there is no way to make it a phenomenal treatment, but it is a treatment that works very well for both elongating and extending. If something bothers you when using the extender, you can try, for example, using some Hembla cream. Hembla cream is a cream containing a topical anesthetic used by tattoo artists to eliminate pain during tattooing. Apply a little cream to the area where you are going to apply pressure, and that is an alternative that you can try if both the scarf and the silicone tape really bother you a lot. If you are thinking of buying an extender, I leave you the link in the description of the video that is androgenital combar patients. It is the brand that I recommend. Why? Because the penis extender, as you have seen, is and many patients need some help when using the extender, and androgenital has a fantastic after-sales service. They answer you if you have any questions, they answer you and explain how to get the most out of the product. You can find on the Androgenital Com Patient Bar website by entering my code, which is Dr. 236 Dr. 236. You have a 20% discount on the purchase of the penis extender. I hope the video has been useful to you. If so, give it a like and subscribe to the channel. You know that I have a friend who has a lot of videos about urology and male sexuality that we are on TikTok, on Instagram. We are doing live on Sunday 10 p.m. Spanish time, 3 p.m. Mexico time. If you have any questions, connect and I will solve them for you. All the best.